when you're suffering from an illness that other people may not fully understand. This is a conversation about the mind-body connection, but not in the dismissive way that phrase is sometimes used, because it's not all in your head. Humility matters in medicine. Listening matters in medicine, because patients often know when something has profoundly changed long before medicine has the tools to explain it fully. Hi, my name is Dr. Gary Kaplan. I'm founder and medical director of the Kaplan Center for Integrative Medicine in McLean, Virginia. Today, I want to talk about something that sits at the intersection of medicine, neuroscience, trauma, and humanity. I want to talk about what it means to be seen, what it means to be heard, and what it means to be respected when you're suffering from an illness that other people may not fully understand. This is a conversation about the mind-body connection, but not in the dismissive way that phrase is sometimes used, because it's not all in your head. What we're talking about today is the very real biologic relationship between trauma, stress physiology, the immune system, pain processing, autonomic function, and long-term health. We're going to talk about the trauma that occurs when people become invisible inside the medical system, especially people with illnesses like chronic fatigue syndrome, fibromyalgia, post-treatment Lyme disease syndrome, PANS-PANDAS, chronic pain syndromes, and many other conditions where the suffering is profound but not externally obvious. People often look fine. People are often told they're anxious. People are often told they need to exercise more. People are told everyone gets tired. Everyone has aches and pains. And yet, these illnesses can be utterly life-altering. Some people become completely homebound. Some lose careers, relationships, financial stability, and identity. Some spend years moving from doctor to doctor trying to convince someone that what they're experiencing is real. And many develop a second wound on top of the illness itself, the wound of not being believed. So today, we're going to explore the experience from several different perspectives. We'll talk about adverse childhood experiences and long-term health. We'll talk about PTSD related to medical trauma. We'll talk about invisible illnesses and invalidation. And we'll talk about how families, friends, and medical professionals can become more healing and less harmful. Because one of the biggest human needs is not simply treatment, it's recognition. One of the great shifts in medicine over the past several decades has been the growing understanding that early life experiences shape long-term health outcomes. Many people are familiar with what's called the ACE study, the Adverse Childhood Experiences Study, originally conducted at Kaiser Permanente and by the CDC. The researchers looked at categories of childhood adversity before age 18. Things like physical abuse, emotional abuse, sexual abuse, neglect, exposure to domestic violence, parental substance abuse, mental illness in the household, incarceration, and loss of a parent. Each category counted as 1 point toward the ACE score, and what they found was extraordinary. The higher the ACE score, the higher the risk later in life for depression, anxiety, substance abuse, cardiovascular disease, autoimmune disease, chronic pain, obesity, diabetes, and even shortened lifespan. This was one of the studies that helped medicine understand that trauma is not merely psychological. Trauma becomes biological. And that does not mean damage is permanent or destiny is fixed, but it does mean that prolonged stress during critical developmental windows changes physiology. It changes inflammatory signaling. It changes cortisol regulation. It changes autonomic nervous system balance. It changes pain sensitivity. It changes immune functioning. The body adapts to survive difficult environments, and sometimes those adaptations later become illness. One of the most important things to emphasize here is trauma is not weakness. There are physiologic responses to overwhelming experiences. And importantly, the research also shows that supportive relationships, therapy, emotional safety, trauma-informed care and resilience-building interventions can improve outcome. Healing relationships matter biologically. Being understood matters biologically. Feeling safe matters biologically. And that brings us to something medicine is still learning how to recognize: medical trauma itself. Most people think of PTSD in the context of war, violence, or catastrophic accidents. But PTSD can also emerge from medical experiences. And for many patients with chronic illness, the trauma is not only the disease itself. It's the repeated experience of helplessness, fear, dismissal, uncertainty, and invalidation. Imagine being severely ill for years while test after test comes back normal. Imagine losing the ability to function, but having no visible evidence others can easily recognize. Imagine hearing, "The labs are fine. You just need to reduce stress. You need to push through. You're catastrophizing. You're deconditioned." Over time, people begin to question themselves. Many patients have described entering medical appointments already anxious, already braced for disbelief. And this can create a profound nervous system response. Research has shown that PTSD symptoms can occur after ICU stage, cancer treatments, severe illness, invasive procedures, and prolonged medical uncertainty. And what's important here is that trauma is not defined only by the event itself. Trauma is shaped by whether someone feels powerless, unseen, trapped, or unsafe during the experience. For many patients with invisible illnesses, the medical system becomes associated with fear, not relief, not safety, fear. And this becomes even more painful when children are involved. One of the most heartbreaking situations occurs in illnesses like PANS and PANDAS. These conditions involve sudden onset of neuropsychiatric symptoms associated with infections and immune dysregulation. Families often describe dramatic, overnight changes in their children. OCD symptoms, anxiety, tics, eating restrictions, rage episodes, cognitive changes. And because the presentation can be confusing and poorly understood, many families spend years searching for answers. Some parents have described feeling dismissed, blamed, or viewed with suspicion. Indeed, some of my patients have actually been reported to Child Protective Services in the emergency room. This disease was so misunderstood. And whether or not every clinician agrees on the mechanism of or diagnostic framework, what cannot be ignored is the suffering these families experience. Parents are trying desperately to help children they know are no longer themselves. Children are frightened, parents are frightened, families become isolated, and this highlights something critically important. Medicine must be capable of holding uncertainty without dismissing suffering. Not understanding everything about a disease doesn't mean the patient isn't suffering. Humility matters in medicine. Listening matters in medicine. Because patients often know when something has profoundly changed long before medicine has the tools to explain it fully. One of the cruelest aspects of illnesses like MECFS, fibromyalgia, is that the severity is often invisible from the outside. Someone may look healthy while internally experiencing crushing exhaustion, pain, cognitive dysfunction, dizziness, sensory overload, or post-exertional collapse. And many patients describe the same painful social interactions over and over again. They say, "I'm exhausted." And someone responds, "Yeah, I'm tired too." Or, "My joints hurt sometimes too." The problem is not maliciousness. The problem is that people interpret another person's illness through the lens of their own experience. But ordinary tiredness is not the same as pathologic fatigue. Fibromyalgia is not simply aches and pains. Myalgic encephalomyelitis chronic fatigue syndrome is not just needing more sleep. Some patients cannot tolerate light or sound. Some can't stand long enough to shower. Some crash for days after minimal activity. Some lose the ability to work, socialize, or even leave the house. And because they don't want to constantly complain, many become silent. That silence is often misunderstood as improvement. but frequently it's resignation. There's also grief involved. Grief for the person they used to be, grief for the lost futures, grief for relationships that changed because others could not understand. Research repeatedly shows that feeling dismissed worsens psychological distress, isolation, and healthcare experiences. People don't necessarily need everyone to fully understand, but they desperately need people to believe them. I may not fully understand what this feels like, but I know that it's real. That sounds incredibly difficult. What do you need today? Would you like advice, help, or just someone to listen? And that last question is extremely important because many times all people really want and all people really need, and the most important thing you can do for someone is to listen. Those responses calm the nervous system because validation reduces isolation. And importantly, validation is not the same thing as pretending to know every answer. In medicine, we sometimes fear validating suffering because we worry that we're endorsing a diagnosis prematurely. But acknowledging suffering is not diagnostic surrender. It is a human care. And for loved ones, one of the most important things is to stop comparing. Don't say, well, everyone gets tired, because the patient already knows that. What they are trying to communicate is not the existence of fatigue. They're trying to communicate the severity, the relentlessness, and the loss of function. Another important point, people with chronic illness often spend enormous energy trying to appear normal. So if they finally tell you how bad things are, it usually means things are very, very bad. Medicine is extraordinarily powerful, but medicine also has blind spots. Historically, illnesses without clear biomarkers have often been psychologicalized prematurely. And why psychological factors absolutely influence health, as they do in every human being, we must be careful not to reduce unexplained illness to imagined illness. The absence of complete understanding is not the absence of disease. Medicine needs more trauma-informed care, more humility, more listening, more interdisciplinary thinking, more respect for patient narratives, more research into neuroimmune and autonomic disorders, more support for complex chronic illness patients. And we need to remember something fundamental. Therapeutic relationship itself changes physiology. Feeling safe changes physiology. Feeling heard changes physiology. Feeling respected changes physiology. The nervous system is constantly asking, am I safe? Am I alone? Am I believed? And how we answer those questions matters, not metaphorically, biologically. Before we close, I want to speak directly to those of you living with a chronic illness. If you spent months or years searching for answers, I know how exhausting it can be. The reality is that you may need to become an active participant in your own healthcare journey. And while that's not always fair, and it can be incredibly difficult, it makes a tremendous difference. One of the most important things you can do is find healthcare professionals who are willing to listen. Not doctors who claim to have all the answers. Doctors who are curious. Doctors who are humble. Doctors who are willing to say, I don't know yet, but let's keep looking together. A good therapeutic relationship matters. You deserve to work with clinicians who take your symptoms seriously and treat you with respect. It is also important to seek information from credible sources and experts who have dedicated their careers to understanding your condition. Medicine is vast. Not every physician specializes in every illness. Sometimes finding the right expertise can change the trajectory of your care. If you're seeing a doctor that isn't exploring your condition further or not giving you the help you need, find a new one. I can't tell you how many patients we see who have seen 5, 10, 15 other physicians or specialty centers trying to get help. It's an incredibly difficult, costly, exhausting journey, but you need to continue on it to get the care that you deserve. Another powerful resource is community. Many people with chronic illness feel isolated. connecting with support groups, online, patient organizations, and others who share similar experiences can provide education, encouragement, practical strategies for navigating daily life. Sometimes simply hearing, "I've been through that too," can be incredibly healing. I also encourage patients to keep records of symptoms, questions, treatments, and responses. When you're dealing with a complex illness, having a clear history can help you communicate more effectively with your healthcare team, and perhaps more importantly, trust what you are experiencing. It doesn't mean assuming you have all the answers, but it does mean recognizing that you are the expert on your own lived experience. If something feels wrong, if your symptoms are affecting your life, if you know that your health has changed, you deserve to be heard. Never confuse a lack of answers with a lack of legitimacy. Your symptoms are real. Your experience matters, and you deserve compassionate, thoughtful care. I want to close with this thought. Many people living with invisible illnesses are fighting two battles simultaneously. One battle is with the disease itself. The other is with invisibility. And sometimes that second battle can be just as painful or even more painful than the first. To be seen, heard, respected should not be viewed as an optional extra in healthcare. It is part of healing, not because empathy cures every disease, but because suffering deepens when people are abandoned inside it. So whether you are a clinician, a caregiver, a friend, or someone struggling yourself, I hope this conversation reminds us of something essential. Human beings heal better in the presence of understanding than in the presence of dismissal. And sometimes the beginning of healing is simply this: I believe you. If you like our content, please make sure to like this video and subscribe to our channel. And if you're interested in the services we provide at our center, please visit us at kaplanclinic.com for more information, including many free resources. I thank you for watching. I wish you health, healing, and much joy along the way.